in the Western Jamaica Campus Research Seminar Series. This is an initiative that was brought to us by the Office of the Campus Director through our director himself, Professor Donovan Campbell. We started last semester, and so far we have gone 3 presentations, with this being our first for this semester. These research seminars and presentations have become an integral part of the Western Jamaica Campus's calendar. These activities provide a platform for our faculty, students, and academics, and the wider community to share in their research interests and strategies. Our presenter today is Mr. Desmond Croker. He is an assistant lecturer at the University School of Nursing here at the Western Jamaica campus. He is also a PhD candidate at the Texela University, where his research surrounds diabetes management, care, and prevention. He's also a lifestyle coach and expert in the care and management of diabetes. His research is titled Assessing Diabetes, Self-Management Support, Integration in Routine Care, Effects on Emotional Burden and the Glycemic Control in Westmoreland. Please join me in welcoming Mr. Desmond Croker. Mr. Croker.
Thank you very much for that wonderful introduction. Colleagues, a short person was it before me, right? All right, is it better? Yes. Colleagues, I am elated this afternoon to share with you my passion. Diabetes management has been my passion for the past 12 years, and more so self-management, because self-management empowers the person with diabetes to take charge of their condition. And you know, the research continues to show that this approach is the most effective approach, both in terms of the results as well as cost effectiveness. And so I'm delighted to share with you this afternoon assessing diabetes self-management, support integration into routine care. All right, so we're looking specifically in this research at the effects on emotional burden and glycemic control. How does this intervention affect, in memory of my mother who died in 2007 of complications of diabetes, one of my reasons for being so passionate about diabetes self-management. So this presentation seeks to evaluate the integration of diabetes self-management education and support into routine care. So, in terms of an agenda, we look at introduction, the background of the study, the problem statements, the framework for the research, the methodology, and we'll be using the quantitative method my intention is to use a quantitative method for this research. All right. So in terms of a background to this study, right? Diabetes is a significant public health challenge in Jamaica. And this contributes to high burden of morbidity as well as mortality, as well as healthcare costs. You know, when I was in Trinidad, I recall the Minister of Health at a conference saying that chronic diseases, which diabetes is one, can cripple a country financially. And so we're saying that this is the effect that diabetes can have on a country. So the prevalence of diabetes in Jamaica has been steadily rising with an increased number of individuals affected by type 2 diabetes. This chronic condition presents complex management challenges, particularly in low resource settings, where access to specialized care, medication, and structured self-management programs is often limited. Some key challenges in diabetes management in Jamaica include limited access to education programs, right? Particularly in rural areas. Another challenge is financial constraint. I hinted to that already. Preventing individuals from affording medication, blood glucose monitoring supplies, and healthy food choices. A third challenge with diabetes management in Jamaica is limitation in the healthcare system. This includes overburden, all right? Overburdened healthcare facilities, a shortage of diabetes specialists. As far as I know, I'm the only diabetes specialist in the western Jamaica, in the western part of Jamaica, all right? Shortage of diabetes specialists, inadequate follow-up and care, all right? That is a big challenge. A challenge is low adherence to self-management practices, all right? We know people go to the doctor, they're diagnosed with diabetes, they get treatment, and that's it. Nothing else happens, all right? And so that leads to low adherence because of lack of awareness, motivation, or social support for the person who has diabetes. Because, you know, I was talking with a client the other day, and he was saying to me that this thing about diabetes, you know, when you just get it, you know, and people tell you all these things will happen to you, you feeling quite fine, you know, you take things for granted until 20 years after, when all your kidney starts to shut down, your heart starts to shut down, and so low adherence. The last challenge I have here is psychological and emotional burden. And this is the area that I want to zero in quite a lot for this research. And this impacts individuals' ability to consistently engage in self-care behaviors. So, given these challenges, structured interventions that integrate both education and psychological support into routine diabetes care are essential. We need to not only prescribe medication for these people. We need to not only tell them, don't eat this and don't eat that. We need to provide practical interventions that they can implement and have their diabetes well managed. So, diabetes self-management, education, and support play a crucial role in improving the health outcomes of individuals with diabetes. The American Diabetes Association and other leading organizations emphasize that diabetes self-management, education, and support should be incorporated into diabetes care to empower patients with the knowledge, the skills, and confidence in managing their condition effectively. So diabetes self-management, education, and support focuses on blood glucose monitoring and medication adherence, healthy eating and physical activities, problem solving, a critical aspect of diabetes management. Because when the person with diabetes is at home, outside of the healthcare setting, and issues arise in terms of their diabetes management, they are the ones that have to make the decisions as to what to do about those things that come up. But if they are not empowered with the skills to problem solve, there is where we have a challenge. All right, and prevent diabetes self-management, education, and support focuses on that. preventing complication and reducing risk, and lastly, addresses the emotional and psychological aspects of diabetes. Research has demonstrated that individuals who receive diabetes self-management education and support experience improved glycemic control, so the blood sugar is controlled. They reduce diabetes distress and emotional burden. There's few hospitalizations, increased engagement in self-care behavior, and a better quality of life. Diabetes management extends beyond just the medical and lifestyle intervention. It also involves psychosocial and emotional challenges that can significantly impact self-care. Diabetes-related emotional burdens include diabetes distress, which is frustration and emotional strain associated with managing diabetes daily. These people have to be dealing with diabetes every single day, every moment of their life. Burnout, which is an overwhelming feeling of exhaustion and disengagement from diabetes self-care. And you know, a lot of time these people might come to the hospital, come to the clinic, and it's obvious that they're not taking the medication, they're not following. Why? Because of things like diabetes distress. You know, they're fed up. You know, they're trying and nothing is working for them. All right? Anxiety and depression, right? Increased stress levels often linked to fear of complications. Because when they see this blood sugar not going down, all they're thinking about is that next thing for me is that my foot is going to have to cut off. Next thing for me, my kidney gonna fail. All right? And so these are the emotional burdens that people with diabetes encounter. And as a result of these emotional burdens, there is poor self-care behavior because I'm trying all that I can do and nothing is happening. So what is the point? What is the point in taking these medications? What is the point in eating right? All right? So there's poor self-behavior, such as inconsistent medication use and unhealthy eating. There's decreased motivation and self-efficacy, affecting their ability to make positive lifestyle changes. They're not motivated anymore. There's higher HbA1c, which is one of the key markers for indicating progress in diabetes management. Therefore, addressing these emotional challenges through targeted interventions is critical to improving diabetes self-management overall well-being. So by incorporating support through diabetes self-management education and support, individuals can develop coping strategies, enhanced resilience, and sustain better diabetes management behavior as a result of these interventions. Therefore, the purpose of this study is to evaluate how integration of diabetes self-management education and support into the routine diabetes care in Westmoreland, Jamaica, and assess how this can impact on reducing emotional burden, which is associated with diabetes care, improving self-management behaviors and patient engagement, and enhancing glycemic control, which is measured by, as I mentioned before, the HbA1c levels. Westmoreland, Jamaica presents a unique case in this research due to the high prevalence of diabetes in the region, limited access to structured self-management programs, what's happening? Psychosocial barriers to effective diabetes care, including financial challenges, lack of social support, and emotional distress. So by conducting this 6-month intervention that includes both group and individual support session, this study aims to provide empirical evidence on how diabetes self-management education and support can be successfully integrated into routine diabetes care. The findings will offer valuable insights for healthcare practitioners, policymakers, and diabetes educators, helping to shape future interventions that prioritize both physical and emotional aspects of diabetes management. Diabetes self-management requires more than medical treatment. It demands a holistic approach that integrates education, emotional support, and behavioral strategies to empower individuals. Now, this study will contribute to the growing body of evidence supporting comprehensive diabetes care models that address both research, both clinical and psychological needs. By focusing on Westmoreland, Jamaica, the research will provide context-specific insights that can inform scalable, sustainable, and culturally relevant interventions aimed at reducing diabetes distress and improving long-term health outcomes. For literature review, there is quite a number of studies that speak to diabetes self-management, education, and support. However, in Jamaica and the Caribbean, by extension, there is no such study as yet, all right? There's no such study. Of course, there are lots of studies on diabetes of itself here in Jamaica, but in terms of the self-management education, where we empower the person with diabetes to take control. I have not come across any such right now. All right. There are studies also that speak to integration of the emotional burden. All right. Right. There are also studies that speak of the integration of the emotional burden of diabetes care that, again, would support the effort that I am making in using this intervention here in Westmoreland, Jamaica. Gaps in the research include inconsistent implementation and effectiveness of diabetes self-management. Now, even in places where diabetes self-management education and support has been proven, as research has been done, even in those places, diabetes is grossly underutilized. Diabetes self-management education and support is grossly underutilized. More so places like here in the Caribbean, where it is not even done. Only the few of us who would have done some work in diabetes education, we try, but then for most of us, this is not a full-time occupation. All right, so the focus would be on where the bread comes from. And so that is one gap. Emotional and psychological support. Research says that is another gap in the research. All right? Most of the time, the focus is on taking your medication, ensuring that you exercise, eat right. But this aspect of how diabetes affects people emotionally is most time overlooked. And when we do that, the thing is, these people come with all these emotional burden to the clinic, and guess what? They have diabetes distress, they have anxiety, and when they when they are assessed and they're not to where the healthcare provider think they should be, guess what happens? They're cussed out. They're treated in the most demeaning way because it is as if they are being negligent in their care, their own care, when really and truly it is an emotional and psychological issue that needs to be addressed. Another gap is integration with usual care. Diabetes self-management, as I mentioned before, even in countries where the research is done, is grossly underutilized. And, I have worked in the system. I have been in healthcare for the past 30 years, and I have never seen any instance. I've worked a number of places here in the Caribbean, and I've never seen, other than in something similar to this, I've never seen where persons are actually referred or introduced to diabetes self-management. And so it is not a part of what happens to persons when they have diabetes. All right? And I am saying that we need to make it part of what happens. Somebody is diagnosed with diabetes, part of what happens in their plan of care must also include diabetes self-management education and support. Sustainability of behavior change. We all know that habits die hard, and these people who have diabetes, they have lived a certain way all their lives. To tell them to stop eat certain things is hard. To tell them to get up and exercise, it is hard. And so they may try, right? I myself, I remember many times starting exercise, and I'm sure all of us here can relate to starting to exercise, and then after 1 week, 2 weeks, that's it for the exercise program. And so sustainability of behavior change is something that has to be practically supported and introduced to persons with diabetes. So to effectively integrate diabetes self-management into routine diabetes care, future research should focus on developing consistent implementation strategies, enhancing emotional support, improving integration with usual care, leveraging technology effectively, and ensuring the sustainability of behavior changes. Addressing these gaps can lead to more effective diabetes management and improved patient outcomes. Now, what is the relevance of emotional burdens in diabetes management? So, emotional burdens such as diabetes distress and burnout are significant factors in diabetes management, and it impacts both psychological being and diabetes outcomes. All right, and there are research that support this view. The review of existing literature underscores the critical role of diabetes self-management education and support in improving diabetes-related outcomes. So diabetes self-management education and support has been widely recognized as an essential component of diabetes care, equipping individuals with the necessary knowledge, skills, and resources to effectively manage their condition. Evidence constantly demonstrates that structured self-management intervention lead to improved glycemic control, reduced complication, and enhanced quality of life among individuals with diabetes. However, despite these proven benefits, diabetes self-management education and support remains underutilized, with barriers such as lack of accessibility, inadequate integration into routine care, and limited patient engagement, hindering its widespread adoption. To optimize the impact of diabetes self-management programs, future research must explore strategies for enhancing patient engagement. And that is critical because, as I mentioned before, habits die hard. And we're talking here about changing habits, about changing behaviors. And so, as healthcare providers, we need to come up with strategies that will help people to consistently make the changes that they need to make. By addressing these gaps, healthcare systems can improve the effectiveness and sustainability of self-management interventions, ultimately leading to better health outcomes and improved quality of life for individuals living with diabetes. Now, diabetes is a growing public health concern in Jamaica, with increased prevalence rates and associated complications that strain both the individual and the healthcare system. Both are strained. Effective diabetes self-management is crucial in controlling blood glucose systems. Effective diabetes self-management is crucial in controlling blood glucose levels, preventing complications, and improving the quality of life. However, several challenges hinder self-management, including limited access to education. So, in terms of our problem statement, we realize that there are challenges in diabetes self-management in Jamaica. That is one of the problems that we have identified. We've also identified that part of the challenge is the emotional distress and its effect that it has on the glycemic control. When persons can't, when people get burned out, when people get fed up of what's happening with them, they will stop managing, and that can increase their blood sugar levels even more. We've also identified that there are gaps in the current diabetes management practices, which I've outlined before, and those gaps need to be filled if we are going to make any impact in the management of diabetes here in Jamaica and the world by extension. So, my research objectives include, the primary objective is to evaluate the effects of integrating diabetes self-management support into routine care. Specific objectives include assessing the impact of the HbA1c levels at 3 months and 6 months to determine the impact of this intervention in the person who has diabetes. The second objective is to identify the emotional burden of each participant in this study and assess the impact of this intervention in their diabetes management. And thirdly, we're going to evaluate changes in self-management behavior as a result of this intervention. So, my research questions are, how does the integration of self-management support affect the HbA1c level? 2, what is the impact of addressing identified emotional burdens on participants' self-management behavior? And you know, I want to stress and emphasize the fact that it's about understanding what's happening with the person who have diabetes, rather than just giving them medication to bring that blood sugar down. So identify the burdens that is affecting them. The third question, how do changes in self-efficacy relate to diabetes outcomes? So the framework of my study is the social cognitive theory. And the social cognitive theory is well suited for this study because it provides comprehensive framework for understanding how individuals' behavior, social influences, and environmental factors interact in diabetes self-management. This theory, developed by Albert Bandura, focuses on self-efficacy, and that's what this is about, empowering the person with diabetes. It's not about the healthcare provider telling them what to do. It's about giving them the skills, the knowledge that they need so that they can make those decisions daily and momentarily for themselves. So this theory aligns closely with the objectives of the research, which is self-efficacy as a key determination of diabetes self-management. Observational learning and behavioral model making. Social support as a reinforcement of mechanism. This is all part of the social cognitive theory. Reciprocal determination principle, addressing emotional burden, which is what I've been emphasizing over and over as the challenge. And long-term behavior change. Again, it's not about a quick fix. It's about long-term behavior change, sustainability. The person with diabetes has to live with diabetes for the rest of their life. And so their ability to sustainably manage their diabetes is what counts most of all. This study is going to use, as I mentioned before, the quantitative methods. And quantitative research methods involve collecting and analyzing numerical data to quantify relationships, trends, and patterns. In this research proposal, quantitative methods will be employed to evaluate pre- and post-intervention effects on each participant. So the quantitative data, the participants will be adults with diabetes in Westmoreland, Jamaica. And the intervention is a 6-month program where persons with diabetes will meet weekly in group sessions for the first 3 months. Weekly for the first 3 months. And for the second 3 months, there'll be monthly sessions. And we are hoping to measure at the end, at 3 months and 6 months, we will be comparing the HbA1c of the persons with diabetes, and we also be using the diabetes distress scale, which is a tool that is widely used to assess distress. We'll be using the problems areas in diabetes assessment tool as well, which is another one of those well-researched tools. And we will also be using, in order to measure their self-efficacy, we'll be using the Summary of Diabetes Self-Care Activities tool, which is also well used. So data collection and analysis, as I mentioned before, the HbA1c levels will be measured at baseline at 3 months and 6 months. Then we'll have the emotional burden assessment using the DDS and PAID tool, and we also assess self-management evaluation using the SDSCA tool. Then statistic analysis of pre- and post-intervention outcomes will be also analyzed. Expected outcomes is a reduction in the emotional burden related to diabetes self-care, improved glycemic control, which is measured by lower HbA1c levels, enhanced self-management behaviors, and strengthened self-efficacy and social support. Contributions to diabetes management in Jamaica and the Caribbean is one of the significance of this study, highlighting the role of the emotional support and diabetes care, as well as policy recommendation for integration into diabetes, for integrating diabetes self-management into routine care is one of the reasons for contribute to the significance of this study. In conclusion, addressing emotional burden is key in diabetes self-management. Diabetes self-management can improve self-care behaviors as well as health outcomes for the person with diabetes. Study findings the study findings of this research could inform future diabetes care policies, and I really would hope that it does make that impact. These are some of my references, and I thank you.
Thank you so much, Mr. Croker, for this very informative, relevant, and critical presentation and research that you will be conducting. I just want to say, oh wow, that was my thought when you started to present. Being from Westmoreland myself, I was very surprised to find that you are the only diabetes specialist in the parish. Anecdotally, I know of the need, because myself and my families and colleagues, friends, everybody is affected by this disease. I will take chairman's privilege and ask the first question, then we will open to the floor. And for our colleagues online, you may go ahead and pose your questions. How do you think, Mr. Croker, how can we get the medical community to recommend this kind of treatment, diabetes, self-management, care, and support as part of their plans? Thank you.
Thank you for that question. And that's the reason why I have chosen to do this research. Because when it comes to policies, when it comes to implementing things like this, we need to provide scientific evidence, all right? And I'm hoping that presenting scientific evidence of the effect, all right, when we compare what these people are like at the beginning of this intervention, and like I mentioned before that I did something like this in Trinidad already, with less than the resources that I have now in terms of diabetes management, because as the years go by, I continue to improve my knowledge. Yeah, as the years go by, I continue to improve my knowledge and skills in diabetes management. And in that intervention, 82% of the participants had significant improvement in their condition. And so I'm hoping that when I can bring about this scientific information, I will be heard. Yes.
No, thank you, Mr. Croker. What an interesting piece of research, and much needed. You can see the direct link to the policy need. I have a couple of questions, just related to your review of the literature and some of the things that are actually out there. I'm curious because you're looking at the impact of diabetes on the emotional state of the patient. Is there any research that actually links the condition itself to one's emotional state, if you understand what I mean? So you're looking at it from the standpoint of how how distressed the patient is, but does the disease itself impact the level of distress from a biological standpoint?
Okay. I'm not sure if it actually does that, but I know that from a biological perspective, things like feeling tired, feeling extremely thirsty, these things can affect persons emotionally, all right? Because you want to do things, but then you're not you don't have the energy to do those things, and so that can have an emotional effect in and of itself in person.
That's exactly what I was. That's exactly what I was wondering.
Yeah.
Thank you. And are there differences in terms of what you're seeing in terms of how women manage diabetes compared to men? Yeah.
Oh yes. Actually, I am thinking of another study where I look at how men relate to self-management as against how women, right? And there are differences in how they would relate to.
I'm afraid to ask who is managing it better.
Well, I don't know if it's who manages it better. It's about understanding it from the person's perspective and implementing strategies that will relate to the man as against the woman. All right. I always say it can never be a one-size-fits-all. It must be individualized.
We have a question from online, Mr. Croker. First of all, excellent presentation.
Thank you.
The question is, what is one strategy that you can recommend to increase education to affected persons in self-managing their condition, especially those who are in the rural areas?
I believe that the best strategy is results. When I start working with people and they experience the results. I was talking with a fellow diabetes educator from the US, and one of the things that we have agreed to is that people with diabetes do not appreciate the effect of diabetes self-management until they experience it. All right? So for us who specialize on, when we tell them about diabetes self-management and say, you got to pay for this, they're like, why do I need to have, there's resistance to paying for it. But then, again, when I was in Trinidad, managing the chronic disease clinic, I remember quite a number of times doctors bringing patients to me kicking and screaming because the doctor kind of gave them the impression that Nurse Croker is going to make them do what they have to do. And every single time, without exception, these patients leave my office saying, I'm happy that I came here. And so my answer to that question is by showing results. All right, when other persons see, right? I did 2 cohorts of this program in Trinidad. When I was finished with the first program, I had to keep away people for the second program. I had to put a stop in because it spread so much that persons were very interested and wanted to be a part of it. And so that's how I think it will be implemented.
Okay, so Mr. Croker, you mentioned that you're the only diabetes specialist in the western part of Jamaica.
Yeah.
So what would be possible reasons or factors why there are not more persons in this particular area in healthcare, and what can be done to pique an interest in self-management in diabetes?
All right, great question. Thank you. One of the challenges with more persons coming on board is that there is no space in the healthcare system for somebody with this specialty. People don't want to get into something. People go into things because they want to be able to, first of all, make an impact, or maybe that might be the first of all, but they want to be able to earn an income as a result of what they have studied. And so, you know, except for in Trinidad, like I said, where I was asked to be in charge of a chronic disease clinic, I have never had an opportunity to actually full-time work as a diabetes specialist. And so people seeing things like that will not want to venture into that.
Okay.
Yeah.
Okay. Thank you, Mr. Croker. We have a comment from online, and it goes, "Well done, Mr. Croker. Your presentation was very informative and definitely encourages me as an applied psychologist in training to engage in said applied research to inform policies."
Thank you very much. Thank you.
Thank you. Good afternoon. Firstly, I wasn't able to make the full presentation. Given the comments and the review, I'm assuming that it went fairly well. I don't know if this was covered in your presentation, but what I've noticed is on the slate of sicknesses, diabetes is not one that is readily out there. Do you think that there needs to be more education out there for persons with diabetes? And I ask that because my family, there's a certain member in my family who has it, and I've noticed some changes, and I'm not au fait with the characteristics. And trying to do some research myself, I'm not getting I'm not getting through the right channels, I would say. So again, do you think there's more, or there's a lack of education or edifying material out there to engage persons who are treating, both in having it and treating someone who has it?
Yes, there is. The thing is, the thing about diabetes self-management is personalized. And so to really go and find information out there specific to that, you will get general information. And so implementing something like this has to come with experience working with people who actually have the diabetes, understanding what's happening with them. All right? And like I said, as I interact with people, I learn more about what's happening with them and how to relate to it, right? I even use my own experience working on preventing diabetes, because my mother, as I mentioned, died from complication of diabetes. All our siblings have diabetes, so I am at risk for developing diabetes. And so I experienced some of the thing. Well, I suppose because I'm always conscious of it, I'm always looking out for the symptoms associated with diabetes. And so I learn from my own experience. I learn from the experience of people that I would have interacted with, and these all combine, along with, of course, education. All right, I am part of the American Association of Diabetes Care and Education Specialists and American Diabetes Association. Oh, by the way, last November, I was awarded the title of Senior Fellow of the International Diabetes Federation. All right, connecting with these organizations is where you're able to get the kind of knowledge.
We have another question from online. This individual is not sure if they had missed it, but they're asking if you had used a control group to assess the effectiveness of your intervention and had in the past.
No, I have not used a control. I never used a control group. I just used a baseline of these persons' status and measure the results at the end.
Okay, Mr. Croker, do we have any more questions from the audience or online? It seems as if we have no further questions, but it's my pleasure to close. This was such a very informative and educative session, and I'm sure that we will be getting a lot of hits and questions on your presentation. It is so well relevant and needed. So thank you once more. Let's give him another round of applause, colleagues. So as we close, I want to express gratitude on behalf of the Office of the Campus Director at the WJC to you, Mr. Croker, to your attendees, both present and online. And we look forward to seeing you in another 2 weeks for our next presentation. Look out for information via Mona messages and the WJC info. Thank you. Have a good afternoon, everyone.